Hello, my name is Parker Lahosky, and I will be presenting a case on Pasteurella endocarditis. Pasteurella is a gram-negative coccobacillus typically found in the mouth and upper respiratory tracts of cats and dogs. And although it is commonly associated with superficial infections following a bite or a scratch from these animals, Pasteurella has also been identified as a rare cause of more invasive infections such as endocarditis, bacteremia, and meningitis. Additionally, while superficial Pasteurella infections tend to have classic symptoms of erythema, swelling, pain, and purulent drainage, invasive infections can be difficult to diagnose because they lack specific features to identify Pasteurella as the causative pathogen. We present the case of a 74-year-old male with BPH, diabetes, hypertension, hyperlipidemia, and a 40-pack-year smoking history who was admitted to the emergency department for acute confusion after being found down by his wife. In the emergency department, his O2 saturation was 86% on room air, and he was intubated. A CBC showed marked leukocytosis, and blood cultures were drawn, which were positive for Pasteurella. Further investigation into the source of the infection revealed that the patient's dog had been licking his leg wounds prior to admission, and this was identified as the likely source. An echocardiogram showed severe pulmonary hypertension with no evidence of endocarditis. So emergent catheterization was performed, and it showed non-obstructive coronary disease. The patient was started on meropenem, vancomycin, and daptomycin, as well as norepinephrine and vasopressin as pressor support for septic shock. He developed worsening mental status and new focal neurologic deficits prompted an MRI, which revealed multiple embolic infarcts throughout the brain. However, follow-up CTA found no evidence of stenosis or aneurysm in the neck or circle of Willis. A transesophageal echocardiogram revealed a large, highly mobile vegetation of the mitral valve with high potential for embolism, which is seen here in the images above. Cardiothoracic surgery recommended 6 weeks of antibiotic therapy prior to surgery, but the patient suffered 2 more embolic strokes and family opted for palliative care. Despite aggressive antibiotic and vasopressor therapy, the patient ultimately expired. Infective endocarditis is a relatively rare disorder that carries a high mortality rate, and Pasteurella has been reported as the causative organism in less than 50 cases. Although classically associated with soft tissue infections following an animal bite or scratch, invasive Pasteurella infections can occur in elderly and immune-compromised patients, even in the absence of pre-existing valvular heart disease. In these patients, invasive Pasteurella infections have been described in the absence of a bite or scratch, indicating that licking of a wound is sufficient to cause infection, as seen in our patient. This case shows the importance of asking about pets in the home when taking histories, especially in the immune-compromised. Additionally, these patients should be counseled on the risk of invasive infection when allowing pets to lick them, as this is seemingly an innocuous behavior, but it can have fatal consequences when the body's defenses are compromised. So our teaching points from this case are that although typically associated with superficial infections, Pasteurella can rarely cause invasive infections such as endocarditis. Invasive Pasteurella infections tend to progress rapidly and carry a mortality rate of about 30%, even with aggressive antibiotic therapy. Given the high mortality rates and rapid progression of disease, emphasis should be placed on preventing disease rather than treating once disease occurs. And as such, patient interviews need to include questions about pets in the home, and special care needs to be taken to counsel them to take steps to avoid unnecessary exposure to potential pathogens, especially if they are immune compromised. Thank you.